But I think part of the story that's interesting is that University of Iowa grad is really kind of the starter of this overall project, a guy named Rob Kaufman. Rob is at the University of Washington in their injury center. And we worked with Rob for a number of years on learning the method of trying to predict injuries from the crush patterns of cars after they've been in a crash. So over the years, in developing that relationship, we started to look at the different technology solutions that we could apply to traditional digital photography. And because the smartphone has become so ubiquitous, we've essentially started to develop an app around some of the basis of the principles that Rob Kaufman developed.
The app is really nice. It's an iPhone-based app, and so when there's a crash, usually one of the state troopers will kind of make sure the scene is safe and control traffic flow, and then they can take out their iPhone and open the app, and they take these standardized pictures depending on the type of collision it's been, whether it's a front-end collision, a rear-end collision, or a rollover, or a side collision. They would take different pictures. And once they get those pictures, they can edit them a little bit to adjust the zoom and the frame, and they can redact faces to keep it confidential. And then they send the app through through the internet to us. And so we get a notification at the charge nurse desk that there's pictures ready to be looked at. And the charge nurse would then notify the emergency room team and the trauma team, and we can start pulling up the pictures, a lot of times even before we know that the patient's coming. And so we can review the pictures and look at the way that the car's been damaged. And the way that the damage sort of intrudes into the passenger compartment tells us a lot about the type of injuries that we can expect. And so if you see, for instance, the driver's side door is pushed way in, you know that you're going to be dealing with some left-sided shoulder and chest injuries. If it's lower, you can almost guarantee you're going to have some kind of pelvic injury or a lower leg injury. And so there's a lot you can tell from just a few pictures that help you predict what kind of injuries you're going to need. And then you can start thinking about how to get the neurosurgeons ready or the orthopedic surgeons ready. And having that extra lead time is really important. And then in the long term, we hope that we can design safer roadways and traffic systems, and when people are injured, be better equipped to take care of them.